Good day, everyone, and welcome to today's session of BioTherapy Live. Today's webinar was anticipated to be speaking with a special guest from India, Dr. Sachin Nandekar, but due to technical difficulties in connecting with Dr. Sachin, we're going to go live anyway, or we are going live, and we'll address some other leech therapy or hirudotherapy topics. If we're able to connect, that would be great. We will interrupt our current program and switch to Dr. Sachin. But in the meantime, let's get going with our introduction and a program of questions and answers on hirudotherapy. Take it away. So as I mentioned, today's program was originally scheduled to include an interview with Dr. Sachin Nandekar from India, but we are having difficulty connecting. It's about midnight local time for Dr. Sachin. So what I'm going to do is address some questions and try and provide some answers to questions that were raised on the topic of hirudotherapy. Thank you, Albert, for assisting us again today. And if you can put up those questions, I will do my best to answer them. These are unrehearsed answers, unrehearsed questions. So the first question is, can we get sample policies from you, meaning probably the Better Foundation, for use of maggots and leeches in the acute care setting? I want to pursue both in my acute care wound clinic, wound care practice, and need help knowing where to start. Thanks. Yes, the Better Foundation does have template policies and procedures for both maggot therapy and leech therapy. We also have posted on our website a sample consent form, I believe, for both maggot therapy and leech therapy. I highly recommend consent, not that the treatments are that dangerous, but because many of the maladies that they are used to treat can be quite serious and have poor outcomes no matter what the treatment is. And so it's always important to make sure that that is communicated adequately, to make sure that everyone understands the risks and not only the benefits. Indeed, often there are misunderstandings on the benefits themselves, and it's important to get that clear in everyone's mind. So Sample consent forms and sample policies are available. If you go to the website www.bterfoundation.org, and we'll try and put that somewhere in the chat or in the communications. And then there's a drop-down menu on programs or information, something like that, programs of the Better Foundation. And within there are guidelines, and the guidelines and sample policies and procedures should have all of these. And next question. That's good. Question number 2. Would leech therapy be good for hematomas? So if the hematoma, let's see, how should I best address this? The leeches require and are searching for blood that is not clotting. So they really go for venules, little tiny veins near the surface of the skin. A hematoma is a collection of blood that has extravasated, has leaked out of the blood vessels and is in the usually subcutaneous tissue, but it can be anywhere in a potential space. And it's in the process of clotting. So that's really not beneficial for the leech, and it's not going to be easily withdrawn once it's clotted. Now, if it's fresh, if it's just leaking out and still fresh, then sure, the leeches may be able to drain a lot of that. But what they're doing in the process is secreting anticoagulants to prevent clotting. So potentially, if this is an early clot, their anticoagulants might actually cause this hematoma to get larger, to keep flowing even longer than it otherwise would. So I'm not sure I would consider it a very good idea, either in the early stages or the late stages for treatment for hematomas. A wide variety of other vascular complications where the blood is perhaps in a hypercoagulable state or is clotting within the blood vessels. I think that is a much better application of Hirudotherapy and the leech's anticoagulants. Question number 3. Can leeches be carriers of diseases such that is found in the blood? For example, hepatitis, HIV, etc. They certainly have that potential because they are imbibing the blood. The blood is stored in the stomach, and any cells that maintain, any human blood cells that maintain the virus potentially have that, that any human cells that contain the virus potentially can keep that virus alive. The big danger is if that leech then attempts to suck blood on someone else and regurgitates, so that the blood in its digestive system then gets secreted into the or expelled into the new host, it could transmit a pathogen. And it is the very reason that leeches are not reused, but generally destroyed, at least in the medical setting where you might accidentally use a leech on a different person, another patient in the hospital, for example. So that is how this potential is avoided. Next question. Question number 4. Do you dispose the leech after one use, or can it be reused? Well, this is fortuitous timing. As we just discussed, there is the potential that pathogens, and there can be pathogens that we don't even know about, beyond those that were listed and beyond the ones we talk about these days. Because those could potentially be transmitted to another patient, another host, if the leech were to regurgitate. The leeches are not reused. They are destroyed as best and humanely as possible. There are some people who maintain their own leeches for use again, and there it could be justified to be used on the same person, the same leech. And in those cases, the leeches cannot be reused immediately because they are satiated, and they will not be hungry again. They will not desire and bite for another blood meal for anywhere from 3 months and up. Generally, after 3 to 6 months, whatever blood meal was there has completely been digested. And we tend to believe that there is no pathogen that's there by that time anyway. But in the medical setting, you still do not reuse the leech, even if it's been starving for 6 months on another patient. Next question. Question number 5. For hemochromatosis, 1 unit of blood is usually taken off. How many leeches would you need to get the same results? So the first thing to remember here in formulating an answer is that the blood lost is not only during the feeding of the leeches, and they will feed for somewhere around 45 minutes, maybe 40 minutes, maybe an hour, and then they'll be satiated and they'll drop off. And they may only remove, depending on the size of the leech, 10 mils, 15, 20 mils. But after they drop off, because of the anticoagulants that they secreted, the bite site will continue to drain for many, many hours. And so the blood loss can be much, much greater than what is lost to the leech itself. So how many leeches would be needed to drain off a unit? Well, that might be 8, 10, 12 leeches, somewhere in that ballpark, depending again on the age or size of the leech, and how much blood is draining afterwards. There is some variability that depends more on the host often than on the particular leech. Next question. Question number 6. Do you check bleeding parameters prior to treatment? Absolutely. And even more important, you want to check for anemia, the blood level, hematocrit and hemoglobin before treatment with leech therapy. Blood loss is the goal, or at least a mechanism to achieving the goal in Hirudotherapy. And anemia, or significant blood loss, is the most common complication. You want to know in advance what sort of leeway you have. Are you already near or at a mild anemia? In which case, a significant or profound anemia can develop more quickly, or are you very clear of that anemia? You are, by checking bleeding parameters, now you're also going to be able to better predict whether the individual is going to have a very prolonged bleeding post application of the leeches, or will it be more normal on the order of 3 hours, 6 hours, 8 hours of bleeding post application. Next question. Question number 7. I got lost. These questions were submitted during a lecture of mine in the recent past, so that would be my fault. Why is leech not to be removed? What happens if you do remove the leeches? Well, the leeches are going to create the access port, which we commonly call a bite or a bite site, with 3 sharp serrated teeth. And it's going to hold on to that site with its sucker mouth around those teeth. It's going to hold on very tight. It is, it wants to get its full meal at that time. And so if you try and remove it before it's finished, it's going to fight you. It's going to try and hold on harder and try and make you go away. It doesn't know, and it doesn't care whether whatever is trying to remove it is the host itself or is some other animal, predator, whatever. It's going to try and hold on, and it's going to try and distract you or aggravate you from your attempts to remove it. And one of those is through the process of regurgitation. And you don't want it to regurgitate into the wound because it contains not just your blood, but also bacteria that are the normal symbiotic inhabitants of the leech's gut. So the risk of infectious complications, wound infection, are substantially increased if it regurgitates, and that is more likely if you try and force it off the bite site. So if at all possible, and there's rarely a reason not to let it continue for the 30, 45, 60 minutes that it's going to hold on and suck the blood. Next question. What is the lifespan of a leech? Well, leech biology and leech lifespans vary with the species, of course. but those that are used medicinally, such as Hirudotherapy medicinalis or verbena, may live for many, many, many years, as long as they're able to get a blood meal every 6 months or so. In fact, the leeches used medicinally come in different sizes, small, medium, and large, or maybe they're actually measured by gram size of the leech. You can purchase a 7-gram leech, a 12-gram, a 15-gram leech, and these can differ by years. Often the larger or so-called jumbo leeches may be 3 years old or older. Next question. Was leech therapy thought of as a treatment for COVID-19 in patients that have clots formation? I honestly don't know if anyone thought of it. I certainly didn't think of it. And one of the reasons I didn't think of it is because my COVID-19 patients who suffered from blood clots mainly suffered from blood clots in the coronary arteries and the cerebral arteries, where leech therapy is not really going to be able to access. The beauty of leech therapy is that it's a localized treatment. You can get to exactly the single spot, if it's on the peripheral body, where you need those anticoagulants or the phlebotomy or whatever it is, just that foot or the anterior leg or chest or wherever it is. And maybe it is diffuse, but the greatest concentration of the anticoagulants is in the area near that leech that was applied. And the greatest pathology that I've seen, the most significant complications probably that occur in blood clot formation in COVID-19 have been the clots that take out critical organs, blood clots in the heart, coronary vessels, in the brain, the cerebral vessels, in the kidney, and so on and so forth. That's about the best I can answer for that thought. Anticoagulants are used for these patients. So maybe a corollary could be, could leech anticoagulants be used? And I don't know if those have been used or not. The major anticoagulants that I've seen used in this clinical situation have been Coumadin, warfarin, or some of the newer agents, but not anything else. Go ahead. Question number 10, sorry. I'm getting my T's mixed up. Question number 10. Is it painful when the leech bites? I personally have not been bitten yet by leeches, so all I can share is what patients and journalists report, and that is a pinprick-like sensation when the leech bites, a sharp, stabbing, pin-like sensation, which only lasts a few seconds and then disappears because of the analgesics that are secreted along with the anticoagulants. Next question. How are the leeches stored prior to application? So here there are, let's say, two main ways to store the leeches or to answer this question. In the medical setting, and that's what we're primarily concerned with, in the hospital or clinic where someone needs leech therapy, it's usually an urgent or emergent situation where the congested blood that's pooling, not thrombosed, not blood clotted yet, but pooling in the blood vessels, in the veins, because it cannot get out. This needs to be removed immediately because the pressure is building and fresh arterial blood cannot enter the area. So the leeches are ordered, stat, emergently. They arrive, within hours, maybe 8 hours, 12 hours, 24 hours, depending on how quickly they can get it and how far they have to come. And they're not really stored for any practical sense. They're brought to the bedside. If the facility generally treats these sorts of situations, they may store then their own supply so that instead of waiting hours, they have them down in the pharmacy, for example. And that's probably the most common place where they're stored. For hirudotherapists who have their own practice, they certainly store their own leeches and will do so similarly. And that is in a refrigerator, in water, in a tank of water that gets changed regularly. How frequently? That depends on how often the leeches are dirtying up the water. They dirty up the water less frequently if they're in the refrigerator because the metabolism is slowed down. And they're left in the refrigerator to slow their metabolism also because the leeches are hungry. That is why they are willing and eager to bite and take another meal. And you don't want them to suffer hunger if you're going to store them for any length of time. So you put them in the refrigerator, slow down their metabolism. At that rate, the water will get dirty maybe once or twice a week. And you change with special water that has what's called leech salt. Not all salts are really good for the leeches. In fact, the Better Foundation experimented with a variety of salts in order to come up with a salt that we used in our own research. If you have the leeches not in the refrigerator, or if the leeches recently took a blood meal, then the water is going to need to be changed every day, maybe every 2 days, but sometimes every day, in order to remove what the leeches are passing and regurgitating into the liquid, into the water. Next question. How are we doing on time, Albert?
We have about 7 more minutes until 12.
Okay. I'm gonna take this one last then. Where do you order the leeches from? Do you have to have specialized training to use the leeches? Okay. So there is no requirement for medical personnel to get special training to use the leeches. It's not unlike maggot therapy, which is the only other animal currently used and FDA cleared for marketing in hospitals and clinics. That said, any practitioner is going to feel more comfortable and do a better job and know how to anticipate and prevent or mitigate problems if they do have some sort of training. And training courses are readily available. The Better Foundation provides training courses, and other organizations do as well. So that's the issue of training for leech therapy. What about where to get leeches? I would address this question with by sorting out two different answers. There are leeches that are cleared by FDA, what I will call medical grade leeches, and there are leeches and suppliers that are not cleared by FDA. If you're a medical personnel, you should stick with the FDA cleared leeches. Non-cleared leeches that might be used by hirudotherapists, not in the medical setting, are available from all over, and you can find them easily and readily on the internet. But only 2 companies in the United States have FDA clearance to dispense medical grade leeches. One is Leeches USA in New York, and the other is Carolina Leeches from Carolina Biological Supply in, I hope I get this right, North Carolina. And both of those distributors have websites and are readily found on the internet. They are also linked on on the Better Foundation website under Hirudotherapy suppliers. Well, let's go back to the video at this point, Albert, and see if there were any questions on the Facebook page. Do you see any questions on the Facebook page? And I will look as well. I'm not seeing any. Are you seeing any?
I do not see any as well, Dr.
Okay.
Sherman.
Well, hopefully these answers are helpful for some people. They're certainly helpful for the people who sent them in, and we will be contacting those individuals just in case they weren't tuned in today. Thank you for those questions. We will try and reach Dr. Sachin Nandikar for another presentation when all of the electronics and intelligence is working not artificially, not as an imitation, but the real thing, and we can get some connections and all learn from Dr. Sachin. Until that time, thank you for tuning in, or thank you for watching afterwards. Take care and let us know what questions or topics or speakers you would like to see on BioTherapy Live. Bye-bye.